Welcome to episode 91 of the Mountain Mantras Wellness and Life Lessons podcast. This podcast aims to inspire you with wellness and performance tips that you can incorporate into your daily life. I'm your host, Dr. Catherine Gaillet. Learn more about my work at makeeverythingfun.com. My guest today is Dave Chase. Dave leads the vision for Health Rosetta, which is to empower community-owned health plans. And Dave, I was just talking to my dad this morning. We have these fun walk and talks, and we talk about all things life. And I was telling him that I was going to interview you later today. And he said, Health Rosetta is, there's something about the name. We were talking about the Rosetta Stone. And I thought I'd start the interview by asking you how the name came to you.
Yeah, good question. If you know much about the Rosetta Stone, that helped decode the previously indecipherable Egyptian hieroglyphics. And after my last company was acquired by WebMD, and worked through that acquisition integration, and we were on a trip, family in Europe. And at the end of it, we go to London, went to the British Museum. And I was, kind of on this trip, sort of thinking, okay, what am I going to be when I grow up? And then what's the next thing? And at that point, the thing that I had found was very inspiring against the backdrop of, frankly, a pretty depressing scenario with our healthcare system, in terms of just pretty terrible outcomes. The only thing that we're the undisputed world leaders in is medical bill-driven bankruptcy. And yet there was these people who'd cracked the code, like this indecipherable system. They had figured out how to get far better outcomes for literally 20, 40, even 55% less per capita. And so they cracked the code, and I'm going through the British Museum and see the Rosetta Stone. And I was like, oh, that's actually applicable here. And so thus the Health Rosetta. And so that's where the name came from.
And Dave, I love aha moments. Like, they're just the best, right? So what year was this when you were in London and had this aha moment?
Yeah, 2015.
2015. So pretty recently. And when you say that you know that there are people that have cracked the healthcare code, who are you talking about?
Yeah. Well, it's kind of a combination of the people paying for healthcare and the people delivering the healthcare. So on the paying side, we have kind of every flavor under the sun in the US, but where we've tended to focus is on the most broken part of the purchase side, which is employers. And so there's employers, like there's this company that was a focus of mine in my TED Talk, Rosen Hotels. Incredible story we can get into. And they were spending 55% less. They'd been doing it over 20 years. Cumulatively, they've saved over $400 million benchmarked against others, and incredible results. So that's just one example. There's many others. And then on the delivery side, there's organizations like on the particularly primary care, because sadly, we've destroyed primary care in this country. If you're younger than probably 45, 50, you probably haven't actually experienced what proper primary care is, because we've destroyed it and just kind of turned it into kind of milk of the back of the store, and I don't blame it on primary care, but nothing created more fertile ground for the opioid crisis and now the rising benzos crisis than our undermined primary care. And in contrast, you have organizations like Iora Health and Oak Street Health out of Chicago. Iora's out of Boston, but they're all over the place. And I've actually experienced it. I mean, I've done site visits and gone into their facility. It's really amazing. They deal with some of the most medically complex patients. Their focus is mainly on Medicare right now, although Iora has served union populations, employers, and so on. And ultimately, I kind of put my family where my mouth is and got my parents into their plan. And it's really quite amazing what they do. I mean, my dad went through a 5-year Parkinson's journey, and they're not going to turn Parkinson's into la la land, but the right care plan, the right care team, which includes health coaches, social workers, nurses, doctors, of course, and so on, can make all the difference in the world. And through that journey, lots of stuff happened, as you could imagine. My dad didn't spend one day in the hospital. And I know in the previous model he was in, he would have. And not only would have that been rough on him and my mom and myself and my siblings, at the end of the day, knowing what I know about healthcare probably saved the taxpayers $250,000. And IORA is a good example. Their tagline is restoring humanity to healthcare. Kind of sad they have to have a tagline like that, but that's what they've done. And so that's one example. There's many others of the organizations who've cracked the code. And it's been a very iterative process over many years. And that's really the essence of what we're doing is I'm kind of Johnny Appleseed. Like I don't come up with these models. I get the word out and find the common threads that basically create this blueprint that then anybody can run with. That's kind of the idea there.
Well, I love that idea of being Johnny Appleseed. I didn't say yet that you're the best-selling author of several books. I'll put up one of your books here. You're also a consultant on the show The Resident, which is on Fox. And so through these public venues, you are providing advice and inspiration and just maybe that nudge towards change. So I'm going to really drive it home for people listening right now about what we're going to be talking about, because if you have experienced frustration with the healthcare system, if you are looking at the costs of your healthcare plan, if you're an employee and you're frustrated with what's happening to your ability to pay and how that's affecting what we call the American dream. Actually, this is what Dave talks about, is how healthcare is stealing away the American dream. Or maybe you're an employer or you're at the top level of an organization where it's just like you can't even predict how much the costs are going up. And there's, legacies of people. There are people that are already retired that are still on the plan. And how do we continue to provide for and pay for those people's plans and offer benefits to people coming through and hopefully joining the organization? So it's really for people at the individual level that might be experiencing frustration. It's people within organizations that are working for employers and they're going, oh my gosh, I'm scared because I hear about how so-and-so, my friend, was bankrupt by a surgery that was, came out of the blue, right? And then I'm also an employer and I'm worried about modeling this out. So that's kind of how I see your role, as pulling all of this together and putting it into books and putting it into forums and putting it into TV shows, and also just being this voice of, rationality in a world that really kind of seems crazy. So thank you.
Yeah, you're welcome. I mean, it's crazy. That's probably the right word. I mean, we're paying Cadillac prices for a healthcare system that's producing pintos. And what I would say is COVID basically rear-ended our healthcare system and it's blowing up right now. And, that's some silver lining. I think it's accelerating what's already was going to happen. I mean, things that normally would take decades, certainly years, have been happening much quicker. And so I do think it is this pivot point that at least the smart ones will realize. And of course, whether you're a municipality or you're an employer, everybody's getting hit by the recession. And there's very few that are benefiting during this. And it is, classic necessity being the mother of invention. There's a lot of activity now going on and people have kind of had enough. And so then the question is there actually a solution? And most people have been led to believe that fixing healthcare is like trying to fix Middle East peace. Like they'd like that fixed too, but it seems kind of hopeless and out of their control. That's what the status quo protectors want you to think. And so when you feel disempowered, when you feel hopeless, know that there is a way out of that, and the folks that are profiting from that dysfunction are trying to make you feel that way.
And let's get into that, because the Health Rosetta has some focus areas where you're looking for solutions and creating solutions to this huge problem. I did want to talk about something that you cover. It's like a jaw-dropping moment in your book when you talk about healthcare pricing.
Yeah.
And you go through this model. Actually, you have guest contributors to the book, which is fascinating. So you have all this expert advice in there, but the parts about how we price healthcare and how you can go to an MRI facility and say, like, if I gave you my credit card, how much would this cost? Versus if I went through insurance and created a lot of paperwork and all that. And I'm looking at this and I'm going, wow, this is crazy. But there's some solutions there just in, number one, awareness, which is what you're doing, and education to all parties involved. And then just allowing people to be more empowered when they're making decisions for their own healthcare.
Yeah. I mean, sometimes people will say the cost of healthcare are going up, and I tend to correct them and say the prices are going up, the costs aren't going up. Big difference. Other than specialty drugs, there's some specialty pharma that's definitely gone up, and as new drugs. But by and large, if you know any nurses, any doctors, ask them if they're paid fundamentally different than they were 10 years ago. They haven't. Clinicians only get 27 cents of every dollar we ostensibly spend on healthcare. Where's that other 73 cents going? It's profiteering and price gouging and bloat and waste. And what that chapter that you're referencing talks about is in the real market, prices haven't gone up. And what I call the real market is actually a pretty significant market. Because of the era of high deductible plans, you have two dynamics going on. One is a lot of cash pay, where people have such high deductibles, and a lot of direct contracts between employers or unions and healthcare providers. So the data in that chapter draws on that and shows, prices really haven't gone up. I think I referenced Dr. Keith Smith from the Surgery Center of Oklahoma, and I asked him, you can fact check me because you probably read the book more recently than me, but I asked Keith, I said, have you changed your prices and gone up, or, over the last, several years where you've been doing this? It's like, yep, we've changed them 4 times. They went down each time because the inputs for us went down. And so we brought the price down. And he's got a very successful for-profit surgery center. So he's not doing this as a philanthropic thing. Yet you will, he shared an example of a guy that needed a prostate procedure. It was going to be $40,000 at the local hospital. He had a high deductible plan. He went on their site, Surgery Center OK for Oklahoma.com. It was $3,600 versus $40,000. And so he went to his local, surgeon, and he said, I can't not fly to Oklahoma City. They're completely transparent about their safety and all that. And of course, the surgeon wasn't going to get that money. So he raised heck with the hospital CEO. Guess what? They dropped their price from $40,000 to $4,000 because they didn't want to piss off the surgeon. Mind you, they didn't care about the patient so much. So they could just drop it 90%, and they weren't doing it as a charity act. So that just tells you how arbitrary the prices are. I mean, it's almost like, I'd say it's throwing a dart at a board, but it's actually not that. It's just the power of compound interest, where they just jack it every year. They use this mythological term called medical trend to get you think that it's some, thing that's out of your control. And, we're just, you're a carrier like, medical trend is 8%. We got you, slightly better than that. We're heroes. Like, no, it's actually not that. You can look in their stock prices, and you look at during COVID, just the time we're recording this, those earnings a couple weeks ago from the big carriers. I mean, this is how twisted our system is. The carriers, the big so-called insurance companies, they really aren't insurance companies, they're more claims processors, wildly huge earnings. Like the pandemic is the best thing that's ever happened to them from a profit perspective, as twisted as that sounds. And it is. Meanwhile, regular docs, because of the shutdown and people fear going to the healthcare system, a lot of them have seen their revenue drop in half. So it just shows you kind of how backwards our system is.
And I do want to get into what's going on with COVID and how it's affecting the industry, because in the pre-interview chat, you had a really great metaphor or analogy about what's going on in terms of a virus in the system. Yeah. But I like to also have these mantras that kind of bring things home to the listener. And this is for the listener that might be that employee that's really that might be affected by needing to have surgery or needing to have an image done, MRI or something like that. So the first mantra is going to be to get empowered and be an empowered consumer in what is kind of an irrational and overwhelming system. So this is just an action item for the listener. And what I wanted to underline, because I do remember that story about Dr. Keith in the book, and that was that it was price transparency, meaning like he puts his prices on the website, which is extremely unique. So is that something that we can start to ask for as consumers? Like, how much is this procedure going to cost?
Yeah, you can. And the thing that's you have to be aware of is once you pull out that insurance card, sometimes they literally will have a gag clause that they can't offer the cash price. So, unless you're in a true emergency, and most healthcare isn't, I think emergency care is only like 4%, if I recall right. You can get a price. And, that example I gave with the surgery center, that guy ended up getting the procedure at home. And Keith was thrilled. Like, he wants to be a disruptor in this. And so you can use these sites that are out there. And so, yeah, absolutely. You can inquire in that. Yeah, I did that with when my son, some years back, needed to potentially get his adenoids out. I talked to the doctor, hey, we're on high deductible. I know you're not going to get most of it. Can I just pay you now? And like, oh yeah, talk to my office manager. They will do that. You just need to bring it up or in advance, talk about them. And they're a lot more used to that than they were 5 or 10 years ago because of high deductibles. And they have a difficult time collecting balances after insurance is paid. So they like getting immediate payment. It takes them a long time to get paid by the carriers a lot of times. So yeah, absolutely. You can do that. And if they won't do that, you can go somewhere else. Maybe you need to drive an hour. But there was one of the advisors that we accredit in our program. He actually went to the surgery center in Oklahoma for a hernia surgery. And he did this video where he recorded him trying to get prices he's in North Carolina, different hospitals versus what it cost at the surgery center. And it was quite fascinating. And it turned out the highest priced facility of all of them. And because he's in the industry he's in, he has access to things like complication rates. They were the highest price, had the most complications, and they literally had a death from a hernia surgery. And so that's the paradox. When you buy cars, you tend to, you think you spend more, you're going to get better. Some ways it's backwards in healthcare. A lot of times the highest cost, it'd be like hiring me as your plumber. And I charge by the hour. Like, I might have eventually get it done, but I would probably hack it up and it's not going to be very good. And it's really, some level, not that different. The people who do 800 surgeries a year versus the people who do 12 a year, guess who's better? Guess who's got complication rates? And so that's why not only do they have a transparent price, but they have basically a warranty. If you have any complications, you're not going to pay anything. Whereas perversely, some of these hospitals, most of them, they make more money if they botch it because they get a charge there too. So that's just, again, perverse incentives.
That just bugs me. And thank you so much because you brought that metaphor of the Cadillac and the Pinto.
Yeah.
And it's really funny. So Dave and I, we're probably around the same age. When I was a kid and when we would do fortune telling and like, it was really like, great, like you're going to grow up and drive a Cadillac, whatever. That was the great outcome. But the worst one that you could get was the Pinto, right? Because they blew up. So for listeners that are listening going, what does that metaphor mean? It means the car that blew up if you hit it, if it was just a tap in the rear end. But I'm gonna drive home this mantra around considering a cash pay, because sometimes that cash pay can actually be less expensive than if you go through insurance and then have that copay. And again, you have an example in the book, and it's like I was reading that and I was going, oh, how much money have I wasted by thinking that I had this great PPO? But I'm dealing right now with it was a $950 blood draw for a regular blood draw bill that I got from the hospital. And I hadn't done it through the hospital previously. I had no idea. And, I think it was like $120 paid through the insurance, leaving me with 750 something. And so, I'm just kind of needing to call somebody, but now I know I can just talk to the office manager and maybe figure that out ahead of time. And so I had my close to $1,000 lesson. But Dave, you're also working. So those are some great mantras and takeaways for the consumer, that individual that's listening. But you're also doing a lot of great work for employers, particularly those companies sort of in the mid-market size.
Yeah.
And all of your work in training advisors to really provide fantastic benefit plans that provide the Cadillac solution. I don't know if they're at Pinto prices, but you can tell me more.
Yeah. There's a lot of action in that mid-market, right? A lot of these are family-owned or employee-owned organizations, and they want to do right by their employees. There's one, speaking of mountains, a couple mountain ranges over from where you are in Montana, Pacific Steel and Recycling. They're about 750 employees, employee-owned, though you don't have to be to do this, but they are. And in 9 states, 40 locations. And 4 years ago, they were spending over $8 million on their health benefits. Last year, 2019, closed out at under $3.5 million. And benefits had actually gotten better for the employees. Out-of-pocket costs were removed. And for a low margin, kind of slow growth business, when you take $4.5 million to the bottom line, that enterprise is far more valuable. In that case, it's an employee stock-owned company. So basically, your retirement nest egg is your ownership in the company. So they had a great story. I wish I could publicly share the numbers, but I'll give you an idea. It was a forklift driver who retired making $45,000 a year, working for the company, and he walked out with a payout, 7-figure plus retirement payout. And that had probably been doubled because of their health benefits. Because again, a more profitable company is a more valuable company. And so his stock was worth significantly more. And I asked their CFO, I said, what would you have had to do in terms of top line increase in sales for this, mature company to have the same impact on your bottom line? So we would have had to, I'd estimate they're probably a $200 million a year company. It's private. So I'm just kind of estimating, given number of employees, industry, blah, blah, blah. They would have had to increase top line sales revenue 25 to 30% to have the same profit impact as getting smart on their employee health benefits. That's what's possible. Because a lot of times, the probably the chapter that has resonated more than any other in that book is the one that's entitled, You're in the Healthcare Business, Whether You Like It or Not. Here's how to make it thrive. because it's often the second or third biggest cost after payroll for companies. And so it
I
can
was
really,
surprised by that, by the
yeah,
way.
yeah. I mean, GM spends more on healthcare than steel. Starbucks spends more on healthcare than coffee beans. It's crazy what we spend. And so it can really make a big difference. Most companies just think it's kind of this out of control thing. But it's really what it is the last area to modernize inside of organizations, whether it's a public entity or a private company. You know, they've done their sales automation, supply chain, financials. Like this is kind of that final frontier. And that's where COVID is a good catalyst because people are ooh, you know, got to tighten our belt. Maybe we actually need to look at this. And so that's been a nice acceleration for our movement. I mean, of course, we didn't want COVID to happen, but that is a silver lining in it.
Well, maybe it's almost like that area, that cost center was almost like this gnarly hot potato that nobody wants to touch because it is so confusing. It's like
Yeah,
sometimes when I'm reading, parts of the book or we're talking about this, I'm like, is it opposite day?
yeah,
Like, when does a cost center go from 8 million to 3.5 million and get better results? Like,
yeah,
how does that even work? And I'd love for you to expand on that a little bit too, because I mean, let's just do an easy metaphor. If you're looking at, a wine list, right?
yeah,
And because we were using the car metaphor before, but we're
yeah,
looking at a wine list and you're thinking that, at the top of the list, the most expensive wine is going to be the most delicious. And that one thing at the bottom, like, this is a special occasion, so we're not going to go with that because we really want to
yeah.
enjoy it. How is it possible that we can be spending 5 million, almost $5 million less on something, but actually get a better product? So just expand on this, because this is something for all employers to listen to,
Yeah.
because that is a huge difference and it does drive valuation significantly.
Yeah, yeah. I mean, I describe kind of a 5-step process. That there's a acrostic that spells local because a lot of this is about relocalizing health. And the L stands for learn how to leave behind the status quo. So it's just a mindset shift. You know, read the book. It's freely downloadable on our site. Nothing happens until that mindset shift happens. I'm sure that happened with you. Like, kind of blows your mind, but then there's so many data points. It's kind of irrefutable. O in local is optimized plan infrastructure. This is really boring stuff, but if you don't get it right, and very specifically, and where we focused is the benefits broker. So the benefits broker for a company is representing themselves as in the interest of the buyer, but they're paid directly, indirectly by the seller. That leads to massive conflicts of interest, and they're actually making a lot more money the worse job they do when your benefit costs go up. And so what we did was we accredit the ones who are properly aligned. So for those of you who remember, stockbrokers largely went the way of the dodo bird. They got replaced by financial and wealth advisors who had better alignment. It's kind of that same type of thing. So, another way to put it is, if I sue you and also paid for your attorney, that would seem pretty crazy. That's kind of how healthcare works. So those type of things is kind of boring underpinning, but you don't get that right, you can't do the rest of the things. So the C in local is carve out PBM. PBM is a term for pharmacy benefit managers that, any normal person's never heard of these these organizations. They're some of literally the largest companies in the world, Fortune 50 companies. And the shenanigans that go on there are extraordinary. And they're actually getting, in some cases, more money than the actual pharmaceutical companies who, we're not saying they're Boy Scouts, but it shows you how off the rails it is. And so you can typically cut your pharmacy spending 30, sometimes even 50% by getting rid of all the games that they have going on. And by the way, these 5 steps, the first 4 are invisible to the member or clearly a positive to the member. So sometimes people are worried about how are they going to manage change and will this freak people out? So the first 2, nobody noticed. The third one, you either didn't notice or the only reason you noticed is because you're out of pocket costs went down. Like we had a company, as cashier at a convenience store that we'd put in, our community put in this plan. This lady has some condition, out of pocket cost quite high. She's making less than $15 an hour. She had not had a vacation since she'd been married or had kids. For the first time, because all the out of pocket went away, she was actually able to take a vacation with her kids. That's what it means for the regular people on the street. So that was a benefit. Could have been invisible if they hadn't changed the cost sharing. And then the A in local is add value-based primary care. This is rebuild primary care, fully actualized primary care, looks at the totality of health. They know that, food is medicine, right? They know exercise, stress management, lifestyle, all these things that well make a big difference. And then they also are kind of Sherpas when you have more complex things to guide you through this treacherous terrain. I wouldn't climb Everest without a Sherpa. You'd be foolhardy to do. I think you'd be foolish to not have kind of a medical Sherpa. That's what they can do. And in a well-functioning healthcare system, over 90% of the issues people come into the healthcare system for can be fully addressed in primary care. Right now, they're just kind of milking the back of the store to get you to high margin stuff. And so you rebuild that. Guess what? It's impossible to price gouge or surprise bill somebody for a surgery that never happened or for an ER visit that never happened. Half of ER visits are not emergencies. People just can't get into primary care doc. So there's both a direct savings, but it also unlocks. The last thing, the second L in local is leave behind PPO networks. These have become value extraction devices. You pay, like as an employer, you kind of rent these networks for the privilege of wildly overpaying. It's very common to see these PPO network prices charging 5 to 20 times what Medicare charges for things. Makes no sense. And that's where you need to do that last one right. There's some people, like Pacific Steel is a good example. In 2 years, they put in 5,000 direct contracts with healthcare provider organizations. The only way you have 5,000 direct contracts when you're not that big, like they are, is if they're incredibly fair and simple contracts. These are 2-page contracts, really simple, timely payment for the provider. All out-of-pocket costs are waived for the members, so they don't have to chase them. The fair price, win-win. And so that's kind of the way you step through it. It's pretty straightforward. You can rip off the Band-Aid and do it all at once. Some people take 3 years. It's up to you and the culture of your organization and all that. But it's quite a straightforward thing.
Well, I'll put local in the show notes and kind of detail that out. But I think it's extraordinary that you've been able to look at something that, as you talk through it, I'm like, well, of course this is crazy. Well, of course that's backwards. Like, you're right. Like, people are going to the ER because they can't get in to see a primary care physician in a timely way.
Yeah.
And and then you go in and they only have 10 minutes and they really sometimes just have to write a script and get to the next thing, and they're running behind, and
Yep.
the PPOs are charging 5 to 20 times. So it is a totally crazy system. But when you break it down like that, it brings some, like, a deeper breath to looking at the system and some logic to it. I also want to say that in your TED Talk, what I love about your work and how you message in your work is you say, the doctors, the nurses, all the people that are part of the system, they come in wanting to help. They're good people. So if you're listening and you're a doctor or you're part of the healthcare system in any way, we are definitely saying thank you, and we appreciate all of the efforts that are being made here. But what happens is you come in as a helping profession, and then you're in this system that's broken. When a system is that irrational, and I was reading in your book, I had no idea that the suicide rates were so high for doctors, and that people can get into this work to want to help people and end up just being miserable.
Yeah, it's some of the highest levels of burnout and dissatisfaction. You mentioned suicide. Are people who they were called to this. This is truly a calling to be a nurse, to be a doctor, to be a physical therapist, and even before COVID, I mean, we've seen even more, like who would have thought they actually are putting their life in jeopardy as well, because we have hospitals that have marble fountains and they don't have a stockpile of personal protective equipment. And so people are having to jerry rig garbage bags, and that's insanity. And so these are people, and the folks who, as we were talking about earlier, crack the code. Guess what? It's almost all physician entrepreneurs who've developed these new models. Like they're done. Like they're either leaving the profession or they're going to do it right. And there's a lot who leave the profession. And I like, hey, we need you. Let's connect you with the good guys. And the good guys are having no problem recruiting because there's incredible talent that are turned into glorified billing clerks. I mean, doctors didn't go to med school, nurses didn't go to nursing school to be glorified billing clerks. And it's very common. There's been studies that have done that show that doctors are spending 2 hours on paperwork for every 1 hour of patient time. Like, in what world does that make sense?
Crazy indeed. And we've talked about COVID and how we're going to go into how there's always been a virus in the system before COVID. But I also wanted to just be very clear if you're an employer listening to this. And Dave, you did mention this in the I think it was in the C of the local, and that's bringing in a benefits advisor that has been certified, that has the training to look at the system, not through a misaligned incentive lens, but through the lens of what really works for the bottom line and what really works for employees. So talk a little bit about that training program and how employers, because you've got this great directory where people can reach out and then get better services that are aligned with everyone's best interest. Win-win. Stephen Covey.
Yeah. No, we've accredited 217 so far. Is about 1,500 who've started the process. It's a pretty rigorous education process. And one of the things, they're signing up particularly to 3 related things. One is a benefits advisor code of conduct. And part of that is we also have a plan sponsor. Plan sponsor is kind of the industry term for employer unions, basically whoever's paying for the bills. Plan sponsor bill of rights, and then an advisor disclosure form, compensation disclosure form. We found up to 17 undisclosed revenue streams that, of course, the employer had no idea about, that were perverse incentives. And so they are fully transparent on their fees, both direct payment, but importantly, indirect, because there's a lot of indirect coercion and inducements that the carriers and PBMs have. That, for example, let's say you had your clients with a particular big insurance company. And if you retain 90% of them year over year, you'll get big bonuses. And so, though they're supposedly shopping your agreement, they have a huge disincentive to do that, because 30-40% of their income could go away if they move you. And so even some of the good people who want to move their clients, they'll get whacked by their boss in their office, because a given carrier will pay a given office of one of these big, benefits brokerages $250,000 to $500,000 a year in bonuses for that office. That could cover that. Just that one carrier could cover the office overhead for the year. So they'll get whacked. And so that's what a lot of the advisors we have, they've left these kind of big box misaligned brokers and hung out their own shingle and said, we're going to do it right. And the thing that we had a reporter at our last in-person event, and one of the comments he made to me, it's probably the best investigative journalist in the industry for ProPublica. He's like, what I was really surprised about was how many middle-aged white guys at this event. I thought this would be, kind of just younger, kind of started career people. I'm like, no, like there's a lot. They're like, I thought I was doing right by my clients, but I wasn't. And like, I'm going to dedicate, I know where the bodies are buried. I'm going to do this right for the rest of my career. They're 40 something, 50 something. And they're not the only ones, but that's probably the overwhelming, because it's basically a middle-aged white guy industry, pretty much. good old boy deal. And so, it's not like there's not good people in there, because these people want to do the right thing. And we're just showing them, like, we're not asking you to take a vow of poverty. In fact, you're probably underpaid given the sort of scenario like you talked about with Pacific Steel. Like, you can bring, 4.5, 5 million every year for a company that was going out the door. That's incredibly valuable service. So, I'm getting goosebumps right now. I get these heartfelt, almost confessions from these folks. They're like, you know what? I was just burnt out. I was depressed. I was hating my job. And you've given me, your organization, the Broad U, has given me a new lease on life. And I sometimes warn folks as they're starting to sniff around. I said, okay, I'll warn you. And I'll preface this with, like, it's better to have a job than not have a job. It's better to have a career than a job, but it's much better to have a calling than a career. And you're liable to become a maniac like me, and be on some missionary zeal, and it happens. And some of them have to kind of tamp down, like, whoa, big boy, like, you don't have to go on a rampage. Let's just go focus in on, because sometimes they're juiced up with testosterone and they want to go punch bears in the nose. Like, don't go punch the bear in the nose, just go provide a good service and the reward will be there. So it's fun to see that renewal that people have. And we're also seeing career switchers. In our latest cohort, we have an annual cohort. We have a recent White House policy advisor. We have a doctor. We have a hospital CEO. We have a couple PTs. And so I think we're going to see a lot of people, just like, again, you think about what happened with stockbrokers, a new breed and new types of companies emerged around financial services, whether it was financial wealth advisors, but, your E-Trades, your Schwabs, your robo-advisors, there's all kinds of emergent entities. And I think that will happen here.
Well, Dave, you definitely have your calling, and I love what you're doing in this field. And I will put a link to your advisory directory so that people can reach out via the show notes. And I promise that we talk a little bit about COVID. And I think I try to, I of course recognize that it's created a lot of pain and anguish and suffering and all this physical distancing and disruption. But at the same time, there is this opportunity that COVID is bringing to preventative health, to awareness, to all different kinds of areas. And so I wanted to get your perspective on, that maybe that area of excitement that you have about, hey, this could be an opportunity for change. So just a little bit on that. And then, of course, we'll kind of wrap up with how we can find you on, LinkedIn. I know you do a lot there. You're amazing on Twitter. So, of course, your websites and things like that.
Yeah. Well, I would say what it's really brought into clarity for me, and I think many others, is that we're spending more than enough money to fund not only a world-class healthcare system, but to actually restore funding to what drives 80% of health outcomes. The sick care system only drives 10 to 20% of health outcomes. And one of the things we've seen with COVID is resilience has been devastated in our country at a micro level, at a family level. The majority of Americans, are 2 paychecks away from financial ruin. Most, over half of households have less than $1,000 in savings, yet the average deductible is far greater than that. They're functionally uninsured. When your life savings are less than your deductible, you're functionally uninsured. And so what we've seen, like Rosen is an example of this, is the reason we exist at Health Rosetta, our social impact metric, we call it the Health Rosetta dividend, which is freeing up this money. There's well documented over $1 trillion of the $3.5 trillion that we spend is waste. PwC, Institute of Medicine, well documented. And so we have more than enough money to fund universal child care, elder care, pay people, 20 years of wage gains were stolen by the healthcare industry, public health during COVID, right? We're really mixed. There's some communities are okay, most aren't. That really has weakened our ability to resolve it. Social services, clean air, clean water. If you look at in my book, I've got data from Massachusetts. It would be a similar thing in other states. They looked at state spending, and even in Massachusetts, increased taxes so much. And so healthcare spending went up. It came out of all these things: public health, public safety, social services, mental health, all these type of things. So once we get rid of the profiteering, price gouging, waste, and fraud, then you see at a larger scale what happened at Rosen, where they used their Health Rosetta dividend to not only provide the best health benefits package I've seen of any company, but guess what? They pay for their employees' college education. They pay for their kids' college education. And if that wasn't enough, they used just 5% of that dividend to essentially sponsor a neighborhood that was previously crime-ridden. Crime has gone down 78%. High school graduation rates have doubled in that community. And now it's been going so long that you now have graduates of that program because they pay for daycare, pre-K, after-school programs. So far, 450 college educations. That's what's led to this drastic drop in crime, explosion in college or high school graduation. And these kids graduate with exactly $0 college debt. Some of these graduates now have their own kids. They're reading to the kids. They're more ready, and their spend as a foundation, because they have created a foundation, has gone down because they're getting scholarships on their own. So it's coming full circle. So that's what's possible. But it only happens when you have a set of people who say, enough, we're going to do something. And that's by the way, that group is largely, like most hotel companies, largely immigrant workforce. I mean, clearly the American dream is being facilitated there. And so that's the type of thing that I want to really leave people with is we've got that money. We just are squandering it. Let's actually put it to health and well-being. So that opportunity is there for the taking. I think by now we know that the cavalry is not coming from DC to fix it. We've had both parties in full control. So it's on us, and that's the beauty is it's happening community by community. And I think of it as the whole community-owned health plan is this idea of a community can be small communities like an employer or a union. But ultimately it's a place-based thing. And so those initial community-owned health plans where you kind of taking control of it, they're kind of fractals in a larger whole. And so you see communities like Tyler, Texas, where it's now ripped through this community in a good way. And so all the employers there, if they haven't done it, want to do it. And so going back to LEAD as an analogy, that was kind of an analogy with Health Rosetta, credit professionals, certified buildings. That happened community by community. It wasn't like that was evenly distributed. There were places like Portland, places like Denver, places, like that proved it out, and then it rippled around the country. And so that's what we're seeing. It needs to go farther, faster, of course, but it's definitely being done. So we're really excited about that.
Gosh, thank you, Dave, so much for that inspiring reminder that if we can fix this broken system and we can move money to where we need it the most. And, folks, I will put this link to his TED Talk. He talks about the 3 C's and his favorite C being community, and, really feel inspired as individuals within community, within local, to do something about it, because I'm with you, Dave. I don't think the answers are coming from anywhere else.
Yeah.
I think we need to start with ourselves, and for leaders like you that listen to their calling and apply some rational thinking to some overwhelming and irrational models, and really make a change. So you are such an inspiration. I am so grateful for you coming on and sharing this. And so please do share some information about your website and places we can find you.
Yeah, sure. healthrosetta.org. I think .com resolves that. A lot of resources there. You can download my books for free. The PDF version is freely available. There's an executive summary that we just did And I've got a new book coming out in the next few weeks called Relocalizing Health. The future of health is local, open, and independent. So good timing. And so that will be up there. And then on the social media front, I'm pretty much Chase Dave, my name kind of reverse, on everything, Twitter, LinkedIn. You can Google me. I'm not the Sopranos producer. You can find me pretty easily, and happy to connect with people, or just, I really like just pointing people towards the people who can help them, because, like Rachel Means in Tyler, Texas, like, I'm not fixing healthcare in Tyler, she is, and her people are. We just want to empower them, and provide a community. And that's part of the beauty of this community. We have this, our mantra is give one, get 10. And that's the beauty of this, is everybody benefits from this, because there's really almost no unique problems. There's always solutions. People are problem solvers fundamentally around the world, and certainly here. And so we're just connectors on that. So that's a way to get a hold of me. And, I'm happy to point you in the right direction. And, really, really appreciate you coming on, letting me come on your show. And always great chatting with you. We don't do it often enough. And so if there's any way I can help you, let me know.
Well, thank you. I know I have been inspired by this conversation. I hope you, listener, have some things to do on your list too, but I've got some things in the show notes and some links. So thanks so much for listening. And thanks, Dave, for joining us.
Thank you.